Healthcare workers can soon be better protected against abuse and harassment. Singapore's 3 healthcare clusters are set to update their internal protocols based on a standardized set of guidelines by June next year. The clusters comprise public healthcare institutions like hospitals and polyclinics. Alif Amshah with this report.
Tan Hui Wen's been a radiographer for a decade and she enjoys engaging with people at work. However, one encounter with a male patient made her extra wary and even fear for his safety.
He was questioning me, why am I asking him for his name and his NRIC number. He was telling me that the hospital should have a better system. Why do we have to keep asking them for their name and everything? And then I remember him turning verbally aggressive. And then because he was so agitated that I have to take a step back.
The Health Ministry says such incidents form a small minority, but they shouldn't be ignored. It wants to create a safer working space for healthcare personnel through a new set of standardized guidelines. This comes after findings released by a tripartite work group in March. It found almost 1 in 3 workers witness or experience abuse at least once a week.
When your workload is already so heavy and you're carrying the burden of healthcare on your shoulders, and then people abuse you, it may be 1 in 100, 1 in 200, 1 in 500, but that's all it takes to prick the morale of our healthcare workers that has been going through such difficult times already. So I think we really need to protect our healthcare workers against abuse. We lift up their morale.
The guidelines will be adopted by SingHealth, the National Healthcare Group and the National University Health System by mid-next year. It will spell out a common definition of abuse. This prevents confusion as to what entails or constitutes it. It will also list out the types of actions that should be taken against perpetrators. These can be warnings or even removing them from the premises.
In my previous experience, where we have staff, where we say we want to actually go out to actually help them manage this, they were afraid that maybe there could be repercussion. But I think with the framework, with clear guidelines, clear definition, and also the protocols and all that, it helps a lot to clarify things.
Every public healthcare body will have a staff protection team. These will oversee proper and fair reviews of reported abuse and harassment incidents.
And in another show of support for Singapore's healthcare sector, the Health Minister says it can smoothly manage the surge in COVID-19 infections. There are about 500 hospitalizations and fewer than 10 ICU cases currently. Mr. Ong describes these figures as low compared to what was seen during the peak of the pandemic. And he's reasonably optimistic that people have good immunity, given that more than half the population have just recently got vaccinated and boosted.
But if we do not continue to vaccinate and we wait till next year, I think instead of 60%, we may only have 20% that's recently vaccinated. And when another wave hits at that point in time, the impact will be greater, especially on the seniors. Now it's about 5,000 cases a day. It is reasonably, it's quite high, but it's not low either. So it is possible that it will go up some more. But I think it's not something that we have not seen before. Yeah.